Hello, my name is Liliana Haddad. I'm in Mrs. Ferguson's MA 40 class. I wanted to discuss the importance of a professional appearance in the medical assisting field. The combination of clinical knowledge and well put together appearance attracts patients, and it could potentially hurt the center's brand and hinder positive word of mouth, which is bad for the clinic if somebody doesn't display a professional appearance. The job of a medical assistant is not only to perform clinical assessments, but to deliver great service and also to gain trust of the patients. A professional appearance not only displays expertise and authority, but it also increases the likelihood that patients are going to comply with their care instructions. Another positive effect of professional appearance in the medical field is capturing the mind share of the patients. So basically, because of our internal appearance, the center is going to become the first place that customers think of going when something happens and they need to be seen medically. A few policies that are expected of medical assistants as far as professional appearance goes would be that their hair is kept neat and clean. Means that your hair doesn't smell funky, and you have it pulled back out of your face in a professional style, which also brings up the color of your hair. Wild and outlandish bright colors, that's not necessarily considered professional. And if there are highlights in your hair, they should be kept to a natural appearance. Another thing is infection control, which affects patient safety. So basically your fingernails, they shouldn't be longer than about 0.25 of an inch if you're in direct patient contact. They shouldn't be acrylic or fake nails or nails with any dark or super bright colors, maybe something natural or clear if you have to have it. There's also policies against tattoos and piercings, on the face, neck, hands, uncovered arms. A way to go about that if you do have tattoos, which I do not, would be to either purchase some makeup to cover it up, or you could wear sleeves, gloves, band-aids, collar, whatever is necessary to cover those parts of your body that have tattoos. As far as piercings go, it's not professional to have piercings in your face, and it could potentially make people uncomfortable, as some people don't really agree with that lifestyle choice. If you have earrings, they shouldn't be long and dangly. They should be either really short, small hoops or studs, if that. It depends on who you're working with. Sometimes working with pediatric patients makes it equally hazardous for you and for them for you to be wearing earrings of any kind. Wearing street clothes also creates a safety hazard. There's bacteria inside of the fibers of your street clothes, like Staphylococcus and methicillin-resistant S. aureus. They can be harbored in clothing fibers and can also contaminate the clothing of other family members or anybody else who shares a cold water washer with somebody who has infected clothing. Which brings up the point that employees should be wearing uniforms or whatever their designated shift leader has described to them. If they're wearing scrubs or a uniform, then this person should also avoid any decorations that could create safety hazards or obstruct the employee's ability to perform tasks safely. As far as interviews, it's important for you to dress for the job that you want and not the job that you have. That's definitely a saying that I've heard a few times. So basically just dress semi-conservatively. Women should wear dress slacks or a skirt, a nice blouse or a dress. Men should wear dress slacks and a nice shirt. It is acceptable as somebody who's interviewing for a position that they really want to potentially wear some kind of a statement piece. It's more likely that your potential employer is going to remember something that you're wearing than your name in particular. They see so many people on a daily basis that you want to stand out. So maybe a statement necklace, nothing too wild, or a scarf or a sweater or some kind of a unique tie, as long as it fits in with their other rules. If you have a pet, use a lint roller. It's unprofessional to show up with pet hair and dander all over your clothing when you're expected to care for patients that could have potential allergies. Avoid wearing any excessive jewelry or super high heels, plunging necklines, short dresses, sagging pants. Make sure your clothes aren't too tight. You don't want to reveal too much skin or appear like you're uncomfortable. You can't dress down or work in that kind of environment. Flip-flops, sandals, and slippers are definitely not professional. Closed-toed shoes are always required in clinical areas, so it's most appropriate to wear those kinds of clothing. Thank you.